Most families don't know that they need a medical binder until they are in the middle of a health crisis. I remember visiting a patient, and while we was having the visit, he was having shortness of breath. He was having trouble breathing. He had his oxygen on. We checked the tubing, we checked the equipment, we made sure, everything was working fine, and he was still having problems. So we end up calling the paramedics, just for some extra assistance. And luckily, the wife had finished working on his medical binder that we had started a couple of weeks ago. So once the paramedics got there and they was asking questions and want to know this and that, she had all the correct information right there for them. And that saves a lot of time and a lot of frustration. I'm Charity. I'm a registered nurse of 25 years, and for the past 20 years, I have been helping people and families in their homes to take care of themselves. Over the years of working as a home health nurse, I have seen a lot of situations to where patients and family members didn't know the medical history, didn't know what medications they were supposed to take, did not know the doctor's primary care doctor name, did not know their specialty doctor's name. They just go when they get a phone call reminder of an appointment. And not having all of that information readily available can cause a lot of harm, especially to someone who have multiple diseases or chronic illness going on. So that's why I wanted to come on and share some information about what every family, everyone should have in their medical binder. Now, a medical binder does not mean that you're sick and you have all these information to keep up with. Anybody can have a medical binder. A postpartum mom can use a medical binder to help track feedings for the baby, or sleep patterns, or how many wet or dirty diapers they have. Of course, if you have high blood pressure, diabetes, you can also keep a log of your results there. If you're seeing doctors or have multiple hospital stays, a medical binder will be very beneficial for you. Let me tell you why. First, a medical binder can hold all of your medical information in one place. It can be something that you take to the doctor's office with you to your appointments. If you're in an emergency or rush to the hospital, you can have it somewhere where someone can easily go and get it and bring that information to the hospital so that the doctors can have an accurate medical record. They know your medications to take. They know, the next proper treatment without delaying care because of the unknown, right? So some of the things that you do want to have inside of the medical binder, of course, you want to have your medications that you're taking, including over-the-counter, prescription medications, supplements, vitamins. You want to have your medical history in there. What has the doctor given you a diagnosis on? Any surgeries, any past hospitalizations, immunizations. You can have old lab work in there. Have a list of all your doctors or your providers, your primary doctor, a specialty doctor, and just having this bit of information can be very helpful and time saving. So one of the things that I do want to encourage you to do is to start your medical binder today. Grab a piece of paper, grab a notebook, if you monitor your blood pressure, write your blood pressures down. Check your blood sugars, write them down too. Have this information available so that we will be able to help you better, more efficiently in a time of crisis. So let's prepare now so we don't have to wait. If this was helpful, please comment or let me know what is something that you wish someone would walk you through about the healthcare system, and I'll see you in the next video.